and welcome to the Parvo Podcast. I am here today, Dr. Sam, with Robert, as always. Dr. Robert, how you doing?
Good. And you got a new surrounding behind you.
I do. I'm a little off my game because I'm like not in my normal surroundings because we're on vacation. So we're joining you today from our vacation destination.
Well, we still appreciate you making the time. I always feel bad, on vacations, we have to be your time, but it's still a break in the day. Family's
Yeah.
fun,
So
but a
no
little break in the
problem. It's
day.
always fun to talk about vet medicine, no matter even if you're taking a vacation from it.
Yes, and that's we all need a vacation. I think that'd be kind of nice to have sometime soon.
Yeah, right.
So
Sure. I think you probably need one.
soon, we're almost there. So, but I think that's a good lead into a little bit what we're talking about today in terms of vacations is around summer. Vaccines are always a big thing every time of year, but I've recently had to do a lot more vaccines because of my work with general practice. And
Hmm.
fortunately, Dr. Sam has been a huge help in that department because I have forgotten literally everything about it. But I think through this process kind of reemphasized how important vaccines are, just because
Hmm.
I've seen a lot more patients when they haven't been vaccinated, both on the ER side and the weekends.
Right.
And then now that I have those conversations a little more frequently. So I think it's just a good, and honestly, it's a controversial topic. I
Yeah.
think.
It's funny because I think sometimes, you know, some of the things that people worry about are not always necessarily, sometimes it's because they've heard a story that makes them worried, or,
Yeah.
they've not necessarily experienced it, or they have actually seen something that made them concerned.
Mm.
So sometimes it's also weeding through a little bit of like, well, what concerns you about it? What do you think is a problem? And I think probably just given like COVID and all that, not to go down that rabbit hole, but just that maybe people's mindsets on vaccines have changed a bit because of that. Either people who were pro-vaccine are now like a little more skeptical. People who were anti-vax then now are a little more, open to it because of so I feel like you had a lot of people sort of changing sides or even just like looking at things from a new vantage point. And I think the most important thing that I really try to like share with people, no matter who it is, and even remind myself, is it's a part of my routine, right? Every single day I'm giving vaccines. So even I can take for granted, like, okay, should I be doing this? Like, why are we doing this? What is the point of this? Because the fact of the matter is, vaccines, anything you do, anything that you give, medication, shots, vaccines, however you do it, whatever route you use, everything's a medical decision, right? And so
Yep.
for you to say that there is no risk at all with vaccines would be disingenuous. But for you to not look at the benefit versus the risk and see if that makes sense for your animal, I'm going to almost always err on the side of it's what they could get, the disease that we're trying to prevent, especially with our core
Yeah.
vaccines, is far worse than I pretty much any vaccine reaction I've ever experienced. So
Oh, 100%. Not even
yeah.
close.
So part of what informs me and how I inform my clients is like, well, okay, I've seen parvo. I never
Yeah.
want that for a dog. I've seen it end the life of a otherwise perfectly healthy puppy. I've seen them suffer. I've seen people heartbroken. So yeah, I'm gonna err on the side of telling you to get a parvo vaccine for your puppy, because I've seen vaccine reactions to the parvo vaccine, but they are mild and they are totally treatable, and they are, in the ones I've had. Now, are there those rare times where you'll hear a story about an animal passing away or something like that? Those are so exceedingly rare that you can't make medical decisions for a general population based on
Yeah.
less than 1% of one. You know what I'm saying? Like, at some point there is a risk to everything. Believe me, there's a risk to not vaccinating your animal. So you're not without the risk by not doing it.
Yeah, I couldn't agree more. Yeah, I think that's the big thing, and it's just like driving a car. You're not gonna stop driving because there's a risk of getting into an accident.
Right.
You won't, but you still need to drive and you still need to do those things. It's a very similar philosophy for, I think, how you're talking about, like, there's the benefits far outweigh the risk of anything bad happening that there's no reason not to. In case in point, I had a 2-year-old husky this weekend, never vaccinated in its life, and it died from parvo this weekend.
And
It's 2
that's
years old.
that's the tricky part too, right? Like, I feel
Yeah.
like the older ones that are without the vaccine longer,
Mhm.
they're like the course of parvo in a adolescent to older dog is almost always fatal. In fact, I don't think I've seen a dog over the age of 6 months survive parvo.
I've I would say I think it can be harder on them, definitely. I've seen a couple make it, but I think it's part of it because the delay in treatment. I think we don't
Or
recognize it's
even
parvo right away.
recognizing it, right? Because like sometimes like one of the worst cases that I saw was a dog that was actually a working dog. So it was a police dog. And generally those dogs are so well taken care of that it
Yeah,
never dawned on anybody that that dog didn't have a parvo vaccine. And what had happened was there was some miscommunication in the translation because the dogs usually come from like Poland or Germany or something like that. So
yeah,
there was that somebody didn't understand the paperwork properly, so they marked that the dog had in fact been
vaccinated.
vaccinated fully, and then in
Gotcha.
researching it after the fact, because it was actually my case, and this dog came in with horrific hemorrhagic
Yeah.
gastroenteritis, and I thought, well, maybe it's just HGE, but the dog tested positive for parvo, and I was like, could this dog really be like really not be parvo vaccinated? And then we did a deep dive, and it turned out he never had it, but he died because I mean he was so sick.
And then I think you're right on the head there. It's we just don't recognize it in older dogs as often, so we don't think about it, so we don't treat it the right way, we treat it differently in the
Yeah,
meantime. So
right.
it's something that's on. It's just a difficult thing, and also most time we don't recognize it until we do some blood work and we find out that their white blood cell count's really low, and it's like that's weird for a dog that's
But
in its
depending
age.
on when you catch it, I mean, that's the tricky part about parvo, right? I mean, like, so yeah, that's a defining um abnormality, right? But I mean, if you depending on when you're catching it, if you just if you haven't caught it at the time where all those white blood cells are low, you might miss it, because there's going to be an inflammatory phase before all those are
Exactly.
gone. And so sometimes you're going to look at it and think, oh, well, this is probably just HGE because those whites are, either normal or high, and then you're really in trouble.
Yeah, and I think so. I think parvo is obviously one thing we vaccinate for, but I think it's good to
Mhm.
talk about just some of the big things we vaccinate for, which ones are required,
Yeah,
and then say which ones why there are some differences in terms of ones that are not required.
right.
So
And I
yeah,
think we'll notice probably some difference between like states, right? I mean, like I think some things
yeah,
are going to be, in certain places are going to be considered like core vaccines versus others that are
mhm,
not. And then there's some
yeah,
that I think should be that are not, that are more controversial. So I'd be curious to know what the core vaccines, where you are at are.
yeah. So I would agree. I think some of the current standings for what should be a core vaccine, which isn't, is a little outdated.
Yeah, I
I'm
agree.
sure they'll revamp it. They revamp it every couple of years, but the big ones we distemper, parvo, um,
Well, in
was
that
oh my
same
goodness,
vaccine, you have the paro influenza.
yeah,
So
parainfluenza
so
virus,
you what was that?
the adenovirus, the hepatitis.
Adenovirus. Yeah, exactly.
So
So there's usually like 4 in 1 or 5 in 1, depending on. And I think that also makes a lot of people really nervous. Like there's people who don't understand why they're mixed together.
mhm,
And they're like, oh, I want them all separated. And it's like, well, I'm not even sure they come separated, to be perfectly honest with you. I think you might be able to get like a parvo vaccine by itself, but they're almost always going to be in combination with the distemper, with the adeno, with the parainfluenza.
yeah,
And those are just upper respiratory viruses that are really important that they stay vaccinated for. But the thing is that the body a lot of times will make like a more robust react like more robust um, reaction to the vaccine, and then make a better immune what's the word I'm looking for, immune response.
uh,
It's like very pretty
I
simple
gotcha.
word.
No, but I think that those are a big ones because, like, we look at distemper and parvo. Those can be distemper is almost always fatal in many
Oh,
dogs.
and it's
So,
terrible to see. I mean, they're
yeah,
they're suffering, they look awful, they're so sick. And
yeah,
sometimes that's hard to recognize too, because some of the earlier stages of it, I feel like can look like other things.
mhm,
It's
yeah,
not until it's like starts to become neurologic that you're like, oh, is this distemper? I think.
yeah, absolutely. I think those ones, like, you have to go with a little bit of history and see other signs that might show up the next couple of
Yeah.
days. So it definitely gets a little more challenging. So those are
I
definitely like
think I think too, I mean, not to interrupt, but like I think also when we have these things that are so well vaccinated against, we don't recognize them as quickly because we don't see them as often. Like I think there was probably a time where people saw distemper all the time, so they were like, "That's distemper." or that's parvo. Like when I worked in an area where I saw parvo 4 times a week, I was much more apt to call it that. Where I work now, somebody comes in, I'm sort of like, I mean, oh my god, parvo, just because like we don't see it anymore. You know what I mean? So that
Yeah.
also delays diagnosis, truthfully.
And yeah, and I think that's the big thing about living in San Diego because we're right next to Mexico and it's not as well vaccinated there. And
Right.
unfortunately, I see distemper and parvo at least once a week now, and
Oh no.
it's always a puppy that just came from Mexico. And not saying Mexico, it's had nothing to do with Mexico itself. It's just the standards are a little bit different there right now.
Right.
They're not as heavily vaccinated, especially for a lot of like street dogs.
Mm-hmm.
And it is a very real thing. Parvo happens, so does distemper, and I think it's a great showcasing of like that herd immunity that we try and go for. Like you try and vaccinate as many as you can because it protects everybody else in the process. But when
Right.
you don't, it puts everybody else at risk for those infections. So I think it's like, unfortunately, I hate to use Mexico as the example, but it's a
Well,
great,
you're there. I mean, you're right near there. And the fact of the
yeah,
matter is in our area, it's just like one township versus another, truthfully. You know what I
exactly.
mean? Sometimes it's socioeconomic, sometimes it's cultural. There's lots of different reasons why people's comfort levels with vaccines are often informed by their own lives and their own feelings on vaccines. But
Mm,
but I think sometimes you also need to remember with your dogs, like we have like sort of different ideas than what you have to worry about with people, right? And like
yeah,
just it's just sort of different, I think. It's not generally hasn't been as controversial to vaccinate animals, I don't think. That's a newer thought process. And I think some of that came from some of the questions about like thimerosal and like some of those other things with like, people worried about autism and all sorts of stuff like that. Again, not going to comment on human medicine. I'm not a human doctor. I'm not even going to get into that. But I had like I've had
sure.
people come in and say, like, is there thimerosal in these vaccines? I'm like, I mean, I don't really have to worry about autism in dogs, but
Well, and I think that's well. It's funny because you bring that up because there was a report last week about I can't remember if the Wall Street Journal or one major newspaper that talked about people fighting back more. Actually, no, it was the recent AVMA article.
mm,
People fighting back now on vaccines and like what should veterinarians do because since COVID, obviously there's a big thing with vaccinating for COVID. People are now pushing back more because there was a report in there that people don't want to give it because they think it gives their dogs autism. Your dog's not getting autism. I promise you. Like
yeah,
it's
that's
not a
not like
thing.
a diagnosis we can make in dogs, right?
Exactly.
So I can understand people not wanting to give something that they would deem as poison, right? So like
Yes.
they're worried about mercury levels, they're worried about things like that. Now, there's more education that I think can go along with that, and we
Mhm.
can really get into that. But I don't even think that there is thimerosal in those vaccines, actually. Like, I'm pretty sure I looked it up at the time because I
Yeah.
had somebody that was like very worried about it. And I think I looked it up and I was like, oh, that's, I don't have to worry about it. So I think if it's something that you're worried about, I mean, like make sure that you talk to your veterinarian ahead of time, perhaps. Like, that's not an easy
Mhm.
thing necessarily for people to look into. So if you have any sort of like special requests and things like that, like that's probably something you should call ahead about so that like I feel like most veterinarians are going to be willing to have a conversation with you, but I feel like we are usually like pretty busy in our days, and that's not a 5-second conversation, and that's certainly not something that like we just know. You know what I mean? So it's like I think you do need to like maybe ask them ahead of time if you're worried about that. But again, the things that you're worried about in humans are not, those aren't things we're seeing in animals. So I think it's
Exactly.
also maybe looking at the situation and saying, like, accepting that it could be slightly different. You will read a lot of things online about like trying to give natural immunity to your dogs, like by taking them to the dog park that are, and trying to expose them to distemper or to parvo. I would not recommend that.
No, I agree. Like
I
I was
can't.
at the
I
beach the
can't
other day.
recommend that actually.
No, yeah. I did not even close. 'Cause I was at the beach the other day and there's a dog. It was a dog beach, like dogs all in this. And someone brought their 3-month-old puppy on the beach. I'm like, there's no way you're vaccinated completely yet. Like I just
Yeah.
know it.
Right.
And I'm like, it's just dangerous. It really
Mm-hmm.
is. So it's vaccinating such a good and I think that like yes, we were about some people mentioned autism. We know autism is not a thing that we can diagnose in dogs, and it's not really a concern. But like the biggest concerns, maybe in some cases, are an allergic reaction, which
Right.
are very treatable.
Right.
Yes, sometimes you have to go to ER for it, but in most cases, it's very, very treatable. Some local injection site soreness. So you might be a little sore, just like we would get sore when we get in vaccine. So
Mm-hmm.
that's normal. Every once in a while, you see a patient like vomit or have some diarrhea related to or maybe inappetence for a day or with a fever. That's usually the extent of it. It's very, very rare. I think the biggest consequence maybe is for cats
Mm-hmm.
with feline site sarcomas. Those
so rare, but yeah, that's why we give our vaccines where we do it. So when we
Mhm.
give them really low down in the leg, some people give them in the tail.
Yep.
I do think people should know about that though. Like to me, I feel like it is right for people to be aware of what of the things that can happen and understand. Like, so for me, like I am not somebody that's going to beat somebody up if you have a cat that you're never going to let outside, and like you have a kitten, let's say, and they're like, well, should I get the feline leukemia vaccine? Like that to me, I'll have a conversation with them and I'll say, okay, well, maybe during their first series, doesn't add another injection. You can just add it to the one that you are already giving, which is the, FERCP, which is the feline upper respiratory, it's got a few different things like rhinotracheitis. Like
Yeah.
there's a few things in there that are all kind of in that one vaccine. So I can add
Yeah.
leukemia, and I usually will. So I think leukemia is most dangerous for the really, really young and the really, really old. And a lot of times people have ideas that they're going to be able to keep their cat inside, but then they soon find out that that cat wants to go outside. So I usually tell people,
Yeah.
hey, for this first time, let's go ahead and just get them fully vaccinated for everything. And then as you get to know your cat, if you're like, yeah, this cat's never going to go outside, it's never going to be exposed to anything else, and I really know that I can control the population that I bring into my house, right? So that's the other
Yes.
thing that you have to warn people is like, if you're going to get another kitten at some point in time, or you're going to rescue one off the street, well, they could be bringing leukemia in, and then you're really in trouble.
Yep.
So I think part of it is like, hey, just let's get to know this cat first, but like let's get them fully protected. Then after that, if you never give your cat a leukemia vaccine again, I'm never going to give you a hard time. There are other veterinarians that will, but I will not, because I do think there's a risk for injection site sarcomas, and that's any injection in a cat. It's not just a
Yeah.
vaccine. They are not solely for that. So like anytime you're giving them an injection, you're technically at risk for that. It's a higher probability, I think, with vaccines because of the inflammatory reaction that has to happen in
Yeah.
order for the body to make a good response to a vaccine. It's like a blessing and a curse. It's like what you need for it to work, but it's also possibly why we see a little bit more injection site sarcomas and things like that. So
It's interesting. I
for
didn't realize
me,
with other things too. I didn't realize other injections had a problem too.
yeah, yeah, that's
Like
why they've
Slovenia?
changed it recently to like injection site sarcomas. It's not only, I mean, I've seen a cat, and this is again very rare, so I'm not saying you shouldn't microchip your cat, but like I saw a cat get a sarcoma from a microchip.
Damn. That's a bummer. Um,
I get one, that's one time, you know what I'm saying? Like, and who knows what other risk factors that cat had. And that's the problem. It's like so much of the cat population out there, like we don't really know very much about their genetics because there's just so like, so who knows? You know what I mean? Like
mhm.
you start to see these things that look like they're associated together, but I don't really have any like true evidence that that's real. You know what I mean?
Yeah.
Like I noticed like for whatever reason, all FIV cats, they all have stomatitis. I have no
Yeah.
idea if that's a real thing or not, but I have certainly noticed that.
I think a lot of the ones I've seen have. I don't see as many FIV positive cats, but when I do,
They all have bad teeth, all of them.
yeah, they do. That's interesting.
Yeah, gingivitis,
Yeah.
stomatitis, and then if they're orange, they're gonna lose all their teeth because
That might be
orange
true.
cats already have bad teeth. And I think that there's a genetic thing. Like there's got. I mean, again, I'm putting this out there, and I really should know what I'm talking
This is
about.
the
But
hour with
these are
Dr.
just the
Sam
things that I've
diagnosing
noticed
things.
in practice. So I'm not going to say that there's really a correlation there, but it seems to me like that is very true.
That'd be worth looking into. It'd be a cool study, actually.
Yeah,
So, who wants to
there's probably,
participate in a
I
national
guess if
study?
I looked into it, maybe I'd find that there is actually a study that's already been done. you know,
It's like funny because like certain dog breeds have the same thing where like greyhounds have awful mouths. They're big
horrible,
dogs, but they're just
horrible.
horrendous across the board.
Poodles,
So,
standard
uh,
poodles.
yep, it's just
Yep.
it's a thing. Maybe it's the now.
Something you're signing on for. You get a greyhound, you will be doing dentals with them regularly. Oh,
Yep.
but then you also have to anesthetize them, which strikes fear in the heart of every veterinarian.
It's funny. Well, because I thought only with thiopental, right? We don't even use thiopental that often.
They are
Right.
sensitive creatures. I have a protocol that's just for greyhound, for like sight hounds.
Really?
That yeah, that what was her name? Was that Australian um uh
Dr. Robertson?
no, was the other one. Dr. Robertson is
Anesthesiologist, right?
British. It's
Oh,
the other one that was Australian. She had the brown hair. She was great. But she gave us all like a special
dang.
protocol for sighthounds because they're
Oh,
so
nice.
sensitive.
Huh. Well, all the more reason to be aware.
But I love greyhounds. I'm just it's one of those things that you just sort of need to like keep in the back of your mind that they're a little more sensitive. They can get the malignant hypothermia.
Oh yeah, that's fair. Well, see, all the more reason to, well, not a vaccine, but it's important to know for
Now that
veterinarians.
everybody's afraid to bring their dog to go. Oh, that and then the bleeding thing too.
The bleeding thing's a pain. That one
Yes, right.
I'll handle
So
this time.
anytime I'm just like aminocoproic acid. If you are a greyhound, you're getting it.
Yep, this is your life now.
Yep,
So
this will be what you're getting 3 days before surgery because I'm not going to deal with that after.
smart. It's proactive. Saves the money a lot. Saves the owner a lot of money long term.
But it's
So
also too, it's like I won't sleep at night if I don't know if they're going to start breaking down their cots. I mean, this has nothing to do with vaccines. We got way off the.
yeah,
We'll
so
talk about that
we
another day.
took a pivot. We took a
The
pivot.
fun
We're
of
fine. So
the fun of sight hounds another day. That's another podcast. But anyway, so what is your thought on leptospirosis?
I think it's necessary now. I've seen too many dogs get it, and honestly,
They don't do well.
it's everywhere. I don't think there's anywhere it's not. Anywhere there's a rat, you can have
Yeah.
lepto, and
Yep.
it's just not worth it.
Yeah. I actually don't
So
know why it's not a core vaccine. I think that that's wrong. I think it should be.
I think it should be too. Honestly, I don't know why it's not at this point.
Yeah. And
Um,
it's also one of the biggest boogeymen out there. I
mhm.
don't know if it's like, because I remember when I first got into like working at a clinic, I do remember a lot of the little fluffy dogs would get lepto vaccine reactions.
Yeah,
Like I remember that, but that doesn't happen anymore. I don't notice that. I mean, I'm vaccinating little fluffy white dogs all the time, and they're usually fine with it.
yeah. I don't have a problem with it. Honestly, I don't think I've seen
So I
any
don't know if
major.
it's like maybe the vaccine has changed, like maybe whatever the original formulation was. I mean, because this is
Hmm.
like going back 15 years ago. I don't see that as a veterinarian, as a practitioner myself.
Yeah, I'd have to actually look. Honestly, I don't know. To be completely honest with you. So, but yeah, it's something I haven't run across too much. So I think it's safe to get. Like I said, I give lepto all the time. Now I do at
Yeah.
least. So, because
Well,
I've
and
seen it.
that's the other thing too. I mean, I think that's another thing to bring up is that there are certain vaccines that have to be yearly vaccines, and lepto is one of them because it's a bacterium, it's not a virus. So when people worry about like over vaccinating their dogs, like things like Lyme, things like lepto,
Yeah,
um, bordetella, those are the three I can think of off the top of my head, that are they're bacterial, so
yeah,
they're bacterians. They're not, so your body doesn't just like it's not the same as the parvo or the distemper, which you can get like a 3 year vaccine of that.
yeah. No, yeah. So I'm trying to think of some of the other ones, but I think you get the big ones.
I think
Um,
those are the big three.
yeah, Lima,
Because I'm even
Bordetella.
thinking like for the influenza, I mean that's a virus, but the reason that you get that every year is that it changes.
Yeah,
So that, and actually where I am, we don't see that. So we don't vaccinate for that. Like that's not, we don't just like throw that at people. We don't see it. Now I think 2 hours in the other direction in Chicago, they do. So that's
yeah,
required, I think, around there.
yeah. Exactly. Yeah, because I
Warding
don't.
and stuff like that.
Yeah, because I really don't give canine flu or the canine flu one. So, and we don't really see it though. I'll say like of all, if there's one that's optional, that's clearly very optional for me. I don't even
Yeah,
think
yeah. I think
Bordetella is
that's
that
totally
optional
optional.
anymore, unless, well, unless they're sorry for dogs. I don't think Bordetella is an option because like they're still gonna go outside at some point. I don't know. Like it's only for dogs anyway. That's a dumb question.
My thing with bordetella is I think it's no big deal. Like it's either intranasal or oral. Like most people don't seem to have too much of a problem with that one. I don't think I've ever seen a vaccine reaction to bordetella ever.
I have, I don't think so. But a lot of
I've
times the
never
owners, when
seen
they
it.
come to see me at night, they don't know all the vaccines they got, or they got multiple vaccines. I'm not sure which one's the problem.
Right.
I think that's the bigger problem.
Yeah. Well, I do think that that's why a lot of people want to split them up. But
Mhm.
there's pros and cons to that. I mean, I think some people find like just makes them feel more comfortable to know if they're going to have a reaction, what they had a reaction to. And I think that's fair. And I'm not going to give people too much of a hard time, but I do think that it, if they're going to have a reaction, they're going to have a reaction. I don't think it's because you gave multiple vaccines.
Well, I thought, and correct me if I'm wrong, I thought originally vaccine reactions occurred because of the substrate that the vaccine was in. Not necessarily because of the virus itself. It was the substrate that
It is.
they're,
It's
yeah,
the inflammatory reaction that's happening. It's just an overwhelming one. There's a
yeah,
reason why you can give a pre med ahead of time, and it's still
yeah,
like the vaccine still works. It's not like giving them dexamethasone prior or dex and Benadryl, whatever you do,
yeah,
stops them from having an immune reaction. It just dampens down the inflammatory reaction. So
yeah,
most of the reactions that you're having are usually delayed hypersensitivity reactions. So the angioedema, like the face
swelling.
swelling, like you mentioned, like the vomiting, the hives,
Yeah,
things like that. So you'll just dampen that down with some prednisone, basically.
yeah. And if you're a bull or a pit bull, you're gonna react and reaction really like it or not because I feel like their skin is just like a nightmare for bee stings and for vaccine reactions. They get them all the
Yeah,
time.
it's funny, lately, I haven't seen as many pit bulls with it, but you probably see more pit bulls than me, but,
Yeah.
um, dachshunds are another one. There's just genetic predisposition for it.
It's
You'll
so weird. I don't see
dachshunds.
any dachshunds with them. I don't think I've ever seen a dachshund with them. Really?
Oh, yeah. You should actually warn your dachshund owners because you're
Really?
gonna
Because
see
I've
one come back. Oh, yeah. French bulldogs, that's another one.
Frenchies,
Frenchies.
yeah, that's a yeah,
Frenchies, English bulldogs. And I mean, every once in a while, those little fluffy guys too, like, but they're usually the ones that seem to have the more serious, like, again, these are super rare, super, super,
yeah.
super rare. But every once in a while, I think I've seen them 2 times since I've been a veterinarian in
Hmm,
total, like 2 times, where you just had them sort of seem like they were fading. And then they had to be like, you had to give them a shot and you had to get them on
wow.
fluids and you know what I mean? Like they were
Yeah.
really
Like
like
they're
actually
hypotensive
heavy.
from
Hmm. Yeah.
gotcha. Yeah,
And I think I've only seen it 2 times, truly.
yeah, and I think that's a really good point because, like, obviously, like, more of an anaphylaxis episode is
Yes,
probably, like, the only
exactly.
concern.
But remembering
Um,
too that like the organ of anaphylaxis in a dog and in a cat are different than they are in a person. So in a
mm,
dog, there's some question of whether it's GI and liver, right? And then
yeah,
in cats, it's actually
lung.
lung and wait, lung and something else.
That was just primarily lungs.
I think it's primarily lung
Yeah.
because usually they don't make any other. Yeah. So like the worst, and I knock on wood, and I hope I never see this, but you technically can have a cat have like pulmonary edema and die.
Yeah, no, I've had 2 cats actually recently with, alert or anaphylaxis from a bee, and, they also had a lot of GI signs too, ironically, they had it all. It was a
That's
bad
why I was wondering.
um,
I think it's lung GI. I really do. I
it
was
might
just
be.
listening to somebody talk about it, and I was like, oh, I always think of lung, but I think GI is a secondary one
Yeah,
for
it
cats.
wouldn't shock because, the most 2 recent ones I had this literally the last 2 weeks, both came in, like, nearly trying to die and then given some medications, found their gallbladder was big, and I was like, "Alright, cool. Makes it
So
easy."
what did you do? What did you do to reverse it? Just out of curiosity, because I've never actually
Um,
seen one happen like that. So I'm just curious what you did.
for cats, for, like, these for, particular situations, I give them a dose of Benadryl, I give a dose of steroids, anti-nausea because 'cause they've usually vomited. I throw them an oxygen with a sedative, and I let them chill out. I
Oh,
put them on
okay. So you don't
fluids too.
intubate them, like you don't have like you hadn't get to that point yet where you had to intubate them.
I've very rarely had to intubate a dog or a cat for anaphylaxis. Not that it's
Okay.
impossible, but it's,
Well, no, I know that they're not like getting a swollen. I know that's not happening, but I just didn't know if like they're. I don't know. I was just
no,
curious.
no, no, it's a good question, but, and even epi, as much as, like, human medicine talk about, like, having an EpiPen where and owners always ask if they can have one, I'm like, God, no, because we don't use it that much, even in real anaphylaxis.
Although I've
Um,
heard a lot more people going for epi now, and I'm a Benadryl steroids, like that's always what I grab first. But I was curious
yeah.
if you use more epi.
When it's necessary, absolutely. Like, if they're severely hypotensive, absolutely. Most of them, they come in, they've already like, by the time the owner gets them to us, most of them, they're starting to turn around a little bit at that point. Like, their blood pressure's a little bit better.
Mm,
Like, they've gotten a little better. We give them a bolus, and that's all they really needed.
yeah.
We will give epi, but it's our first choice if we need to give, a press or some sort, but otherwise, yeah.
Hmm,
So,
interesting.
sorry, pivot a little bit from where we were.
No, but it's, I mean, I do, again, like, I'm not in the business of like hiding from people like that these things can happen. Like that doesn't help anybody because it's always a medical decision. It's just that you
Yes.
can't just live in fear of the world. Like you have to make the best decision that you can make. And these are not like new experimental vaccines. I mean, whatever
Oh,
your
yeah.
opinion is of the COVID vaccine, totally, we don't even have mRNA vaccines. Like that's not even an option in
Yeah,
veterinary medicine, right? So like none of these are tried and true. These have been around forever and they are, like again, not experimental in any way. So
exactly.
I think it's good to use discernment and to think about like risk versus reward. I think that that's always a conversation that somebody should be willing to have with you. I don't
Mm,
think you should be made like I try never to make people feel bad if they want to do something slightly differently. As long as I don't see that it's like medically dangerous, I'm going to have that conversation with you, but
yeah,
I also think that you really should be careful who you listen to online. There's a lot of weird information there that's just not
absolutely.
true. And um you either trust your veterinarian or you don't. Like you should have a conversation with them. Your breeder is not a valid medical source. They're just not. They know a
Yeah,
lot about breeding. They know a lot about your breed in general, but they don't know medicine. And a lot of times the conclusions that they draw because of something that they've seen or something that they've heard are actually dangerous. And I think sometimes, like, I've seen some people really listen to their breeders to their dog's detriment. And I think
Yeah.
that that's a problem, especially because a lot of them too, like, they make money off of vitamins or food, or so it's a
Yeah.
little disingenuous. And it doesn't behoove me in any way to do anything that's going to harm your dog. My job is, from the start of them being a puppy, for me to have them live as long as possible. That's what behooves me. Like, if I'm being selfish, if I was money grubbing, that would actually be the way I'd make the most money.
I mean, that's
Not
very true
why
of
I
like,
do it, but I'm just saying, like, it
no,
doesn't behoove
absolutely.
me for them to die.
Yeah, exactly. Like, it doesn't do us any benefit for that to happen. So it's definitely, yeah, take caution, listen to breeders. And even, and I say with caution because there are some very, very skilled people who work in shelter medicine that are non-veterinarians, but they can also be dangerous as well.
Yeah, a lot of them understand patterns, like pattern recognition. They've seen this thing, they've seen this work, they've seen the doctors give antibiotics, they've seen, so like, I've seen a lot of people do some stuff where I'm like, okay, I mean, like, the idea behind what you did was okay, but like, that's not the right dose of antibiotic. That's actually not the right antibiotic for what we're
Yeah,
dealing with here. Like, so your intention was good, but you know, so yeah, I mean, just find a veterinarian you trust that
yeah,
will listen to you. If you, especially if you have maybe some things, like, I always tell people, like, let me know what your thought processes are on stuff, and if we'll try to come to something that you're comfortable with.
yeah. A good veterinarian is going to listen to you.
Yeah,
That's what's important. So if they really care about your pet, and that they'll take the time to listen to you and go over the details.
true. Any other thoughts on vaccines that you have there?
No, I'm good. I've just learned a lot from both you and my clients very recently. So it's been nice.
Well, good for you. You can always just, text, call whenever you have any questions about vaccines.
Oh, I will. Don't worry, I will. So,
But
that's fun.
hopefully that clears things up for people. And if you do have any questions, you can always email us at podcast@mybalto.com, and we can answer questions, especially about vaccines. I don't think anyone should feel ashamed of asking questions. I just think you should trust your veterinarian, though, and understand that, like, we don't just do things blindly. Like, we really have a lot
Yeah,
of experience and science to back up what we're doing. And it's important to us to keep your dogs and cats safe.
absolutely. I can agree more. So hopefully you guys got something out of this, and we'll see you guys next week.
Yeah, as this has been the Pause It podcast. Thanks everyone for listening.